Hi guys, I'm Dr. Anu Joseph, consultant, obstetrics and gynecology and fetal medicine specialist at Trinity Healthcare Clinic, Neeladri Road, Electronic City. I'm here today to talk to you about something which everybody thinks is important, mostly don't do, and there are lots of myths surrounding the do's and don'ts of this particular problem. So what am I talking about? I'm talking about exercises in pregnancy. Everybody thinks it's good to do exercise, but who all do it? And especially when it comes to pregnancy, how many of us are really doing it? Most of the time, the given suggestion from people around, especially in the first trimester, is don't move, don't do this, don't do that, don't get up so far, don't do. And it becomes really frustrating sometimes. And on the other hand, you would have many other people who would be telling you, remain active. So then what do we do about it? So, professionally speaking, unless you have been restricted from doing any sort of physical activity, specifically by your doctor, please do not restrict your exercises. How I counsel my pregnant women changes in the first, second and third trimester of pregnancy. So, let's take the first trimester. In first trimester, what are the problems you might have? You might feel tired, you might be nauseous, you might be vomiting a lot, you might feel dehydrated. And to add on exercise to this might seem to be a trouble. But do remember that if you remain active throughout the day, in whichever way it is possible with you, it can be a slow walk across a park, it can be a 5-minute brisk walk, it can be doing some stretching exercises at your home, or if you have been trained enough to do a few dance steps or Zumba or aerobics, you would definitely feel better after you've done it. So my dear friends, not doing exercise is not an option. It makes you feel way better. And what I would advise is at least 45 minutes of some activity, physical activity, throughout the pregnancy at the very least. So first trimester, if you're really tired, what can you do? You split those 45 minutes. 15 minutes probably in the morning, 15 minutes in the evening, 15 minutes again in the night. Probably after each of your meal, that would also improve your bowel movement. It would improve your hunger. It would reduce your nausea and vomiting. It would take you to a much better place. So try doing it. When it comes to the second trimester, you would feel that it is a very nice place to be. All your nausea, vomiting would have settled. Baby's kicks have not yet set in, so you don't have sleepless nights. You don't feel the bloating yet, so you are having a nice time. Your appetite definitely would have improved now. And this is the place where we see a big jump in weight among pregnant women. Traditionally, women are told to gain weight in pregnancy. But do remember, this was told few generations ago, where women were typically malnourished. In today's age and date, where women are hypernourished or overnourished, weight gain in pregnancy can actually be a little bit deleterious. So let's not go that way. Today, we tell our pregnant women either to restrict their weight gain to less than a kg in a month or probably no weight gain at all. And it's okay, provided it is not based on a diet restriction, whereas by doing exercise that you do it. So what exercise can you do? The best thing is to ask your body. Try out. You can look at YouTube videos, you can see Instagram reels, you can go to a physiotherapist and ask for help, you can enroll in a mother well-being, Lamaze classes. You can do so many things and it's not restricted. So try out. Your body will say, okay, this I'm okay with, but this I'm not. Don't do it. Do something else. Right? So that is how you choose which exercise is good for you. And this is your second trimester. Can you increase the number of minutes that you do the exercise? Yes. Can you increase the rigorosity with which you do exercise? Yes, of course. But one thing you have to keep in mind, don't strain yourself too much. And of course, keep yourself well hydrated. Now going to the third trimester. In third trimester, we slowly put in exercises which are also important with easing your labor and delivery. Even if you are a person with a planned cesarean due to whatever reason, still these exercises would help with the troubles that you will face in the third trimester. Now what are they? You would start with some amount of pelvic and perineal pain, some amount of hip pain, back pain, lower abdominal pain. Now these sort of aches and pains, which are due to an expanding uterus and the baby's parts sitting onto the pelvic bones, will definitely come down when you start doing pelvic exercises. These are the same set of exercises which would help you with labor and delivery. So then why not do them? In addition, doing these exercises would help in making sure that your postnatal time or the post-delivery time goes unrestricted. You will be able to move in your bed, you will be up and about faster, and you would be able to take care of your baby way better. So why don't we do it? Let's start. Not tomorrow, but today. Let's not keep it for another day. Also, another thing that helps, and which probably is a complaint of a good number of women, is lack of sleep in the night. When you do exercise, it generally relaxes your mind. Do it with a couple of friends, it gets even better. And typically, a pregnant woman or any other woman or a human being for that matter, who exercises throughout the day in an ample quantity that suits their lifestyle, their weight and their medical conditions, would have a better sleep at night. So, today you have learned about a lot of beneficial effects of exercises in pregnancy. When tomorrow somebody tells you not to do any sort of exercise in pregnancy, tell them, no, unless my doctor has restricted me from doing exercises in pregnancy, I am going to do it. Hope this video was helpful for you. Me, Dr. Anu Joseph from Trinity Healthcare Clinic, Electronic City, signing off for now. Thank you.